Welcome to Digital Mental Social Health Media, the webinar. Many apologies for the delay in getting this started today. We've had some technical difficulties, which is obviously massively ironic, given the topic of today's subject. We are joined by three panel members who we've been trying to sort the videos out, but not having any luck at the moment, it appears. So joining us today, we have Julian,
Hi.
Monika,
Hi,
and Floro, who are going to give a bit more of a longer introduction to themselves in a moment. So today, my name is Nick Morgan. Well, my name's always Nick Morgan. We're going to be discussing technology and digital support around young people's mental health, looking at both the social aspects of this technology and innovation, as well as the therapeutic ideas and interventions that are currently being used across Europe. As I mentioned, my name is Nick Morgan. I'm the co-founder and director of Euro Youth Mental Health. I'm a youth worker by trade. I've been working with young people in mental health for over 17 years now. And that's me. I'll be a host today, but we're hopefully going to be hearing mostly from our panel members. So if I can just ask the panel members to introduce themselves and tell us a bit more about themselves and why they're here today. If we can start with yourself, Monika.
Hi everyone, I'm Monika, I'm 25 years old. I'm a youth activist for almost 8 years now, and I'm largely interested in the topic of mental health. I graduated dentistry, but my mental health, I'm a mental health activist, and I am joining this webinar because I want to discuss on topics which are of interest for me as a young person.
Brilliant. Thank you very much. And then we've also got Julian Edbrook Charles from Anna Freud National Centre for Children and Families. Julian, can you tell us a bit more about yourself?
Sure. Well, first of all, I wanted to say thank you so much for putting together this really exciting event, Nick. And thanks so much to all of the co-panelists and attendees for joining. So yes, my name's Julian. I'm Head of Digital Development and Evaluation at Anna Freud National Centre for Children and Families. I'm also an Associate Professor in Evidence-Based Child and Adolescent Mental Health at University College London. So I'm a researcher, and my main research interest is how to empower young people to actively manage their mental health and mental health care, with a particular focus on social inequalities. So a range of my research looks at evaluating and developing digital interventions. So I think this is a really important topic, and it's rapidly changing. So I think it's fantastic to be able to kind of gather views from a range of people in today's webinar.
Brilliant. Thank you, Julian. And lastly, on our panel today, we have Floro. Could you introduce yourself, please, Floro, and tell us a bit more about your work and what you do and why you're here? Floro? Oh.
Yeah.
Floro. Yeah,
can you hear me now?
Yeah, you were muted.
Yeah. My name is Floro. I studied Bachelor of Healthcare in Finland and currently working as a registered nurse, and also studying master's degree program in public health, major in health promotion, nursing science, and currently a board member of European Nursing Student Association. So why I'm joined as a panelist, because I wanted to discuss about the impact of digital health to the youth sector, and I could be able to share the knowledge that I will be gaining today to the organization that I am with, hopefully in the future, if we are going to have some assembly or discussion.
Brilliant. And obviously, Flora, you mentioned that you've worked with some young people as well with mental health illnesses.
Yeah, and with disabilities. Yeah.
Brilliant. Okay. So we've got the panel have received a range of questions already to do a bit of preparation, although I'll be kind of helping the conversation flow as we go. And we're currently trying to work on the webcam situation. We're hoping to get everyone's webcams up soon. But in the meantime, we will move on to the first question. How it's going to work is we'll alternate who answers each question first, and then give others an opportunity to comment on that person's answer, as well as follow up their own answer if they'd like to add to it, talk about your own personal experiences, and see where we go from there. The last half an hour, we will have some questions. On your webinar panel, you do have a specific area for questions, so you can type them up as we go so you don't forget them, and we'll refer to them afterwards within the question section near the end. Also, you should now see some slides that we've got up as well, so you can remember to see what we're looking at. So the first question for the panel is a bit of a personal one. How do you use technology yourself in life at the moment? How do you find it supports you, and how it might inhibit or I guess annoy you or be harmful to you? And if I could potentially ask Floro if you're all right to answer that one first, that would be great.
Yeah, sure. Yeah, the use of technology and social media, I think, has become part of my daily life. In the hospital where I'm working, sometimes I feel that most of my time goes to documentation instead of spending quality time with my patients. I mean, in terms of gaining in-depth information through conversation or doing therapeutic communication with them. And at some point, in my opinion, technology has affected me positively and negatively, and even personally and professionally. So as I'm also currently studying master's degree in public health, my time is spent in front of monitors and the use of technological gadgets to aid me in my studies. Due to the demanding needs of my studies, it has also taken my social life and utilized most of my time studying rather than doing health promotional activities that would improve my physical status and improve my mental health needs also as an individual. You know, the feeling that you want to move, but the pressure of making your assignments in front of computers have become a barrier in your day-to-day life basis. So in this sense, technology has controlled my time instead of me controlling it myself. So it's pushing me to be in front of computers and any technological gadgets just to do what the school is mandating or the administration is mandating me. So that's my experience with technology and how it's affected me.
Brilliant. Thank you, Floro. I'm going to actually direct this straight to Julian, if that's all right. Mainly as Floro just discussed about, from a professional point of view, how technology has had a bit of a negative impact in Floro's ability maybe to do other parts of the work. And I'm aware of your work, Julian, around digital development. Is not just for around how young people use maybe more therapeutic roles, devices on therapeutic digital devices to help their mental health, but also how clinicians and those adults and professionals who are there to support them also can use digital work. But I mean, if you could answer that as well as maybe trying to answer the generic question about how maybe you use it, how you found it useful or not so useful, that'd be great.
Absolutely. So kind of echoing a lot of what Flora says, I think it's a really sort of instrumental part of daily life. So particularly in terms of work, having access to a range of different information that's really kind of readily available at one's fingertips is really helpful, and also can be quite overwhelming to try and keep on top of developments in areas of new research. And I think one kind of really important way we use social media is to try and share research findings at a larger scale and much quicker than we would through traditional pathways. So we know that through kind of traditional routes, such as publishing papers, embedding that into teaching and training materials, those professionals then going out and working in the practice and implementing what they've learned. We know through these traditional routes, it takes about 17 years for research to influence everyday practice. So that's clearly too long a gap, particularly when thinking about the rapidly changing digital landscape. So yes, I think trying to use digital technology to engage and make research findings accessible much more quickly, I think that's definitely one of the ways we've tried to use it in kind of positive ways. And yes, I think in terms of digital encroaching on other activities and other areas of life, I think that really comes across in guidelines from professional bodies who say that kind of use of technology and screen time in and of itself may not be detrimental, but if it is interfering with activities in other areas of life, and particularly around physical activity, as Flora was mentioning, diet, exercise, if it sleep patterns, if it's interfering in these other activities, we know that it may well be detrimental. And I guess picking up on what you were asking about, Nick, one area we've been really exploring is how we can use technology to give young people a different way into clinical conversations about their mental health, so they can be using it to have another way into these conversations about really sensitive and personal topics.
Yeah, brilliant. Thank you for that, Julian. And Monika, then following on from, I guess, a bit of what they're talking about, and I guess as your role as an activist, and I'd be curious to hear more about maybe how you also use technology or social media to support yourself and your life, but also what, as it says in the question, what sort of negative impacts do you think it also has on your mental health, if that's okay?
Definitely, like the digital media, the digital world enabled me a lot during my work, especially in the last few years, because many information and opportunities were provided to me exactly through the digital channels. Also in my daily work, most of the work, I work in an international team, so we do use digital tools to communicate, to work. We use the different apps for scheduling, for team management. So this is a big plus, and I believe that the extent of our work would not be possible without these tools. In the same time, I do use digital tools to study as well. A lot of online courses, especially in the IT world. So I do believe there is a big positive impact. The digital tools have a big positive impact on young people. However, in terms of mental health and in terms of interruption of daily life, I think this world has a more negative impact. And I have to say that even in my life, especially the social media, as much as they are connecting us with the outside world, they are disconnecting us from our realities. And it's a pity that young people spend 6-8 hours of screen time per day, and it's a clear interruption of the normal daily activities. So I do believe that this is the negative side.
Okay, and I think that kind of ties into, I guess, the idea, obviously, that we're going to try and discuss a bit more of today is, a lot of young people have a lot of benefits from being able to access stuff. Julian, you mentioned earlier about trying to kind of make those conversations with professionals happen more efficiently and maybe quicker doors and ways in for young people to support themselves. Also, Monika, your reference to the technology opens up this beautiful world to us, and everyone can see everything that's going on across the world, but at the same time it does have a sense of disconnection from the physical in that sense. So moving on from that, here's a question, and Monika, if you're all right to answer this one first, then went on from what you've just discussed. Do you think digital education needs to be a core part of a child's school in order for them to effectively be able to navigate the digital world when growing up, both personally and professionally?
I believe that yes, because I grew up in the last years of non-digital education, let's put it that way. And even when I was a teenager, I felt that I'm missing out on a lot of things because in my educational system, we didn't have enough digital tools. However, in today's world, I think we live in a digital world, so we have to incorporate it in the educational system. Children have to grow up and study in a way that will enable them to use the digital advances properly. However, this should be structured in a way that it will help them, but it will not make them overuse these tools. I think it's a hard task to navigate both, but I believe that it's needed at this point of development of the digital education.
Yeah. And do you mind me asking you a follow-up question, actually, Monika? You mentioned,
Sure.
like, do you think that you mentioned about young people not overusing and being oversaturated with technology? Do you think that that's actually part of the education, is learning how to prioritize when and when not to use digital tools and the amount of time you spend on them?
Exactly, because what's happening in now is a problem that we have even 5-year-old children that are obsessed with digital tools. So I do believe that if we have a proper education and if those kids are exposed to education which will teach them how to properly use social media, computers, it doesn't matter, digital media, digital tools, I think then maybe they will be able to control the amount of time they spend, and they will be able to understand that there is life beyond digital world.
Yeah. Okay, let's just go back the way we came then. So Julian, if you'd like to follow up anything from what Monika said and obviously then answer the question and what your thoughts around this are.
Yeah, so I do agree with Monika, and I think information and communication technology is pretty widely established in the curriculum, focusing on kind of how to use technology to develop professional skills such as around programming. And like Monika says, I think what's a really tough nut to crack is how to educate children about navigating their online and offline lives. And I think children, parents, carers, teachers, policymakers, I think people are really clear that more of this digital education is needed. But I think what's less clear is what that should be and how that should look like. And I think there are so many different pieces to the puzzle. So there are issues around processing of information, data protection. The Information Commissioner's Office has recently published some guidelines for processing children's data, which is out for consultation at the moment. But there are obviously the kind of more personal skills related to safety, social media, mental health, and also increasingly kind of online gambling and gambling involved in kind of games. And I think another reason this is such a tough nut to crack is because I think a one-size-fits-all approach isn't perhaps going to address everyone's different needs. So I think a way of identifying local needs in the community or in school settings, and then having kind of targeted training and support that's meeting those needs would be really helpful. And along that same line, I think what we haven't been as successful at is really co-designing and co-delivering this training and education with young people, because I think without that, we're always going to be a bit kind of behind the times, sort of picking up on what Monika was saying. The issues they're facing today are not the same issues that we've necessarily been facing. And I think there are some really interesting recommendations from the European Commission about this kind of network of digital youth work. And I think some type of network like this could be a really valuable resource to draw on to support with these ideas around co-delivery of digital education.
Yeah, brilliant. Thank you for that, Julian. Floro, any follow-up from anything Julian or Monika have said?
I think they've made a good point already on that question, but I would like maybe to take a perspective on a public health point of view. As we all know that internet access is practically universal for children in developed countries. So at least based on statistics, there are over 95% of 15-year-old students in OECD member countries reporting having links with internet at the home. And in contrast, developing countries, children have still lag in using the internet. So the world has so much inequality or imbalance of opportunities between the usage of internet because of lack of resources. So yes, we need to so many efforts to promote digital education for children in developing countries in terms of academic approach or academic purposes, but more of a regulation in developed countries, as it can disturb their learning process in school the other way around, as we know. And recently, the London School of Economics and Political Science showed that banning smartphones in schools caused a clear improvement in students' test scores. And while on the negative side, on a study conducted in South Korea, that the usage of technology or the usage of smartphone among teenagers in South Korea has actually demonstrated addiction, and that it causes higher levels of neurotransmitter, which slows down neurons among these teenagers. So it resulted in the reduced levels of control and attention and rendering people more susceptible to distractions. So there are pros and cons in bringing digital education to children in school at this point.
That's really interesting, and I guess the point that you're saying is the inequalities and the gaps that technology is moving very, very fast in developed countries, and obviously in the lesser developed countries not so much so.
For young people with disabilities, like children with schizophrenia and attention deficit hyperactivity disorders. And actually, these mobile phones and tablets or gadgets is an intervention for us to calm down them. I mean, you can see a dramatic change of emotion from aggressiveness or hyperactivity into happiness or silence in one corner, even though they've been watching over and over again the same program, but it calms them down. It places them into one place, and it makes them happy and smile. So working with them and using digital technology is also a good approach for us to calm these children with learning disabilities or mental problems.
Yeah. That's very interesting. And in Finland, Floro, do you remember what your kind of like technology, digital, IT sort of education was like?
Finland is one of the most advanced countries when it comes to technology, and they keep on improving, and they really want, or they seek perfection when it comes to technology. It's part of our curriculum in school and University of Applied Sciences. We are mandated as an obligatory course to take digital courses, so we can improve.
Is that
Yeah.
up until what age then, the obligatory digital technology courses?
Even when you study at the university level, you still have digital courses, and the rest of it will be optional, of course, outside from the curriculum.
Great. Thank you so much for that, Flora, and the extra questions. I guess it's really interesting getting an insight of the cultural diversity, but also the similarities. And I referred to Monika's original statement about seeing 5-year-olds using iPhones and iPads, but also, and Flora, your comment around how it's quite interesting that actually, these devices have become a comfort tool, potentially you could say, for a lot of young people and adults as well. Probably. So moving on from there then, thank you so much for that. Moving on, it does kind of flow quite nicely into the next question, which is specifically about social media. And I'd be curious to hear all three of your thoughts, I guess, on, what are the positives and negatives around social media and how it can support or inhibit a young person's mental health, and if you've got any experience either as as yourself or with a friend or someone, a patient you've worked with, to refer to, that would be brilliant. Obviously keeping confidentiality, so no mention of names. That would be great. Julian, am I all right to put this on you to kick us off?
Absolutely. So I guess the first thing I wanted to say was that I think this is a really tricky question, and I think we don't necessarily have a good answer for it. So yes, you may not have wanted to start it with me, but yeah, I think it's hard to say if it's going to be universally good or bad for mental health for everyone. And I think it's really difficult because there are mixed messages coming out in research and guidelines. So we have some studies showing that digital and social media may explain very little difference in young people's well-being. However, on the other hand, this week, with it being Mental Health Awareness Week, with a particular focus on body image, we know that there's a kind of undeniable role social media plays in popularizing unrealistic expectations around body image and the kind of increasing serious concerns across the board people have around body image. So I think we really need to better understand how we can all use social media to support our mental health and our relationships with others. And I suppose it's this more nuanced question about when is it going to be good or bad, and kind of who's more likely to be at risk of detrimental effects to their mental health.
Brilliant. Thank you, Julian. And Monika, would you like to tackle this? And then any personal experience you might think, like references would be great as well, if you've got any. But just generally, what's your, how do you use it? When do you feel like, oh, I've used it really well today, or I've not used it really well today?
Sure. My opinion on social media and mental health is that I have a more black and white opinion. Let's put it that way. I think the mostly it's negative, and why is this? Because as Julian said, there is this unrealistic image that it's showed on social media, and it's not only about body image; it's about life itself. We show the best of our lives on social media, and we see the best of the other people's life. So our expectations of life are changed, and this is not necessarily good, because I think when you have these perfect idealized expectations and when you don't reach them, then here the problem begins. Also, like for young people, especially in this very vulnerable age of when they're teenagers, bullying and like social bullying is a big issue as well. So I think if we compare the positive and the negative, the positives and the negatives, in my opinion, it's more to the side of the negatives. I think that how did it go wrong and when did it go wrong? I think because there is no control over what can people post, and I think people, especially young people, they they grew up to live more in this social bubble, social media bubble, and they give a higher value to it. Personally, yes, I think that in order to change this, we have to again use education, especially in primary school when kids grow, because this is the period when they can be influenced this or another way regarding social media. Of course, another thing that we have to do is controlling the information that gets on social media. We saw how fake news can influence everyone, even the biggest world issues that were happening in the last years were largely influenced by fake news. And not only this, but young people are influenced by fake news as well. So this is another point that we have to work on.
Absolutely. And Floro, would you like to add anything to this? It's obviously it's meant to be a difficult question or an answer question.
Because I have a different background, so I have lived in a developing country for several years and moved to a developed country. So social media is a very good platform for me to interact with my family members way back in the developing country where I live. So it's a good way to interact, to get some updates from each other and get to know each other.
Absolutely, thank you, Floro. A very difficult question on purpose there, everyone. And it is, as you say, it's a very, very, very thin, if not transparent line between, you know, the positives and the negatives around social media. As you mentioned, there is the huge positives of people traveling more and therefore being able to stay in contact with friends, families, and loved ones. But then it's also the flip side is that it makes it easier to share potentially hate-filled or harmful messages to the rest of the world. But thank you very much all for having a go at answering that. That was really, really interesting. Moving on to a slightly, so obviously when we talk about technology and digital, I think we, especially myself, there are two sides of this: social media or tools and apps and things that the general public use. And then there are more specific interventions that are being created by some by professionals, some by companies that are specifically aimed at supporting young people with mental health problems. So the next slide, you know, many mental health services, individual charities and companies as well are now starting to offer digital forms of support. Sometimes developed by specialists, not always, but then prescribed to young people. Why do you think this is being increasingly used as a form of support and therapy? And what do you see? Again, similarly, I'd be curious to hear, you know, your debates of the pros and cons around this. And maybe if we start with yourself, Monika, if that's all right. Hello.
Can you hear me?
Now I can. Yeah.
Okay, perfect.
That's okay. Crack on.
Digital support in mental health services, definitely, like, I think it is a positive aspect. And I think, why is this happening? I think because it is easier to get to young people and to spread these services or support largely, because using the digital technologies we can access more people than not using them. So sharing these forms of support, digital forms of support, I think can be very useful, and it is nice to see that it's developing more and more. I think like, if I think about negative aspects, maybe it can be like, it depends from the method used or the application used, because this mental health support is not direct, it's through an application or digital medium. So depends on the mental health issues and the support provided. This is not, how can I put it? controlled in a way that if something goes wrong, it can be catched in the right moment. Let's put it that way.
Yeah, that makes sense.
Yeah. I'm sorry, Nick, I can't hear you.
I'd accidentally muted myself. Sorry, everyone. I was just asking if Floro could take over from here, and Flora, if you've got any comments you'd like to continue on from what Monika was saying, and generally in line with the question around specifically, you know, support and interventions that doctors and health services have developed for young people with mental health problems.
I just said a while ago that we can use Finland as an example. So in Finland, we have this online health services called Health Village with specific emphasis on mental health. And they call it Mental Health Hub, or in Finnish, Mielenterveystalo. It's an online health service in cooperation with different organizations, healthcare districts, and health organizations all over Finland in the development of the Helsinki University Hospital Mental Health Center. So in the website, you can see the mental health brochures, communication materials, and fine instructions on how to use the materials as a professional, or even for patients or clients themselves. So this digital service saves time and is discreet, reliable, and accessible from everywhere. At least this was according to the project manager of the Mental Health Hub project conducted by the University, Helsinki University Hospital. So the advantage of it is that the online health service gives information on symptoms than random Googling. So it directs questions to the healthcare professionals or doctors, but of course it doesn't replace professional competencies, but it's just a tool that will properly help guide clients or give the right answer to some specific signs and symptoms. And the second advantage is that the early access to help leads to faster recovery. So the goal of this mental health hub is that we reach as many people as possible to get treatment at an early stage, so that problems wouldn't prolong, and you know, there wouldn't be any further complications.
Cool. And then lastly, Julian, if you'd like to continue from what you heard from Monika and Floro in this field, and to elaborate any further thoughts and thinking around research and experiences.
Absolutely. So picking up the ideas around accessibility, one thing we consistently hear from the mental health services that we work with, and I'm sure this will chime with experiences of colleagues across Europe, is that they really want to support all of the young people who need their service, but you know, understandably, they're really struggling to reach everyone who needs to access specialist support. And there's a real kind of strain on resources, and coupled with the evidence that some types of mental health difficulties in young people is increasing, I think a whole range of different mental health support options, including digital, may be the only way we can meet the needs of everyone who requires support. And I suppose what we also hear from the young people we work with is that what they really want is choice and the ability to make informed decisions. So they want to be able to access services in ways that work for them. So for some, this may well be through kind of online counselling or accessing digital interventions. And for others, there'll be a kind of preference to be meeting with someone in person and in real life. And speaking of choice, I think having information to make informed decisions about things like balancing up waiting times for services with being able to have immediate access to digital resources, you know, having this information is really important. So yes, we have a kind of range of different digital interventions, some of which are kind of formally reviewed and endorsed. So we, in this country, we have the National Health Services kind of app library. We also have a range of other different apps and interventions. So some professionals will kind of review and make recommendations based on their own practice. But another thing we consistently hear from professionals and young people is that they want to know which ones they should be recommending and using, and what's the evidence to inform a rationale for why something is deemed evidence-based. So having greater transparency is really important. And I think one of the widespread issues of using these other types of interventions is really around non-adoption and a lack of sustainability. So some people may kind of download something and start to use it, but there's a lot of evidence that continued use over time is a real challenge. And I think kind of going back to involving young people, I think the more we can really and meaningfully involve young people in the development of digital and in real life services, I think this is the only way we're going to make sure that they may continue to be relevant to young people's changing needs and engaging to young people.
Brilliant, thank you for that, Julian. And I think the point I want to highlight that you made there is the people start to use apps, the evidence showing that people start to use apps, but then actually quite quickly, or not quickly, but then do trail off and don't necessarily continue it as an ongoing, persistent thing, which is an interesting thing that needs to be explored. I'm not sure. I want to open it up to, I guess, a question around: has anyone used any? And you don't have to share if you have, but has anyone? Would anyone? And if no one unmutes, I've got can share. Has anyone used digital therapy or digital support before? And by the lack of unmuting, I'm going to say that no one has, because I guess just as I'm hosting this, but I just wanted to share my own experiences very quickly, having used a digital, having received treatment for anxiety through digital support before. And Julian, your comment about trailing off is exactly what happened. I started doing it online, and quite quickly after a few weeks, got bored of it, didn't know if it was doing anything, didn't know if it worked, or and I guess from my point of view then, I just wanted to see someone. So there is something around that you're trying to find a balance of how much you use and rely on digital support compared to face-to-face work with a professional. Okay, I'm aware of the time. We are due to be in the Q&A part now, but I am very aware that no one's asked any questions. I do have some, but I'm very aware we've actually still got one more question left, so we can potentially try and answer this before I maybe ask for one or two towards the end. So this is the last question from ourselves as part of the webinar, and just to give some heads up, Julian, I'm going to ask you to answer this first, if that's all right. So it's very broad, and so you can answer it however you like, really. Technology and digital interventions are considered an inevitable by many. It's going to happen. We have to embrace it. What do you think needs to happen either in your country or across Europe as a whole in order to ensure safe and positive interventions and practices by young people? Yeah, you can feel free to talk about social media, this digital support we just talked about, or anything in those fields. So yeah, Julian, if you're all right to answer that first.
I suppose the first thing I was thinking about is that I think we need a better understanding of what we mean by digital well-being and resilience. And I don't know if we have really kind of cracked what we mean by that, and if we have tools to try and measure that. So I think in judging whether or not our practices are safe and promoting positive practices, I think we need kind of better and valid and meaningful measurement tools. And I suppose I was also thinking about kind of frameworks that support those working with young people to really identify local issues and strategies tailored to those local issues. So I think schools would be an ideal setting for this, to kind of work with schools, identify the kind of digital issues for their pupils, and then provide support to the schools to enable them to tackle these issues. I think these frameworks would be incredibly useful, as we know that schools, particularly in this country, are already really bursting at the seams, not only delivering a comprehensive curriculum, but also supporting a range of other initiatives around mental health. And I suppose my other thought was about the kind of evidence base around all of this. And I think we really do need sort of new responsive research methods, so we can better assess the effectiveness of interventions to make sure they are safe and positive, because I think the traditional research methods we have are a bit too static. I don't think they necessarily have been designed for the dynamic world of digital, and I think we really struggle to keep pace with the changing landscape.
Brilliant. Thank you very much, Julian. Flora, would you like to take this one on next?
I know this is my opinion. I think the European Union Parliament, through its directives, need to ensure that the public, including the vulnerable members of the society, such as the children and youth, are well protected from cybersecurity threats, as most of the children nowadays in developed countries have access to digital services or gadgets. So government officials must listen to the voice of the general public and ensure full protection for children and youth against adverse effects of technology and social media.
Yeah, and I think it's a very well spoken point, Flora, because something that heart for me is around how you do have police who look for things like child pornography and make sure to protect young people through policing that on a digital space. I actually don't know if anyone does have information or papers around the topic of, you know, how that's maybe how and if suicide and self-harm promotion is policed, is looked at. Is there any kind of body doing that work? I don't know. And lastly, Monika, I'd be curious to hear, I guess, your thoughts as I believe the youngest amongst us, to this very, very broad question at the end of this webinar.
Of course, I do agree with all of you, and with Julian, with Flora, about what they said. And I do think that protection is the most important and first step that we have to take in this modern era of technology, because as it showed, like if we don't protect young people, especially young kids, we're gonna face situations which might have serious consequences. But what I want to point out is concretely the digital interventions and mental health among young people, and how we can use the technology in a safe and positive way. I think that here the most important part, I think, is to have a secure and official and valid sources of the information provided online, of the support offered online, of the application offered online. So I think in these terms, a good strategy would be to have programs and projects funded by governments, by the European Union, that will be secure to use. Another thing is also when a young person Googles something of their concern regarding mental health, for example, if they Google depression or suicidal thoughts, they should be redirected to the right place, to a safe place where they can have the true information they need. Because, you know, online information is a pool of everything. We have very useful but also very harmful information, and especially for people who suffer from mental health issues, which are who are very vulnerable. I think it's very important to have this protection in these terms.
Brilliant. So protection seems to be the thing, and I wonder, you know, I would be just a quick question for myself: how much protection is part of education as well in that sense? So we have actually got some questions. We've got 15 minutes left, I believe, or statements as well. So we've got Deborah from Portugal, who is also one of the organizers of this whole week. So thank you for joining us, Deborah, and you've been doing an amazing job. Just more of a comment, not received formal therapy through technology, but uses apparently evidence-based meditation apps to keep mentally sane, which she finds very useful. Also worked in the UK where for Alzheimer's Society, where they developed a clinical trial to try online CBT, cognitive behavioral therapy, to reduce anxiety in carers of people with anxiety. Results showed it really helped. So a positive, I guess, intervention around mental health there. An organization in Europe, they're an online platform for occupational therapy students across the Europe. And they are asking, what would we suggest is the best way for us to balance engaging with people and encouraging positive mental health in their members? Would anyone like to try and tackle that question? It's very broad, and you don't necessarily need to give specific advice, but maybe some ways of making sure that what tools or interventions that they might use are effective and evidence-based. Anyone?
I suppose just being kind of clear about the criteria you're using to determine whether or not something is supported by evidence. So it could be kind of research evidence. It could be through kind of clinical and quality assurance processes. It should be through kind of young people reviewing it and giving their views and feedback. So I think, yeah, having kind of clear criteria that can be consistently applied across the range of different interventions or resources you might be using, and then being transparent about that process.
Brilliant. Thank you, Julian. Would anyone else like to add anything? It's absolutely fine if not. Okay, and then another question. So we've got Borislava Ananieva, hope I'm pronouncing that right. 25-year-old kidney transplant patient. I feel like the stress young patients go through with these kind of chronic conditions is very specific and needs very specific attention. This is one of the reasons I have never referred to online help even after going through intense panic attacks and very hard time getting back to normal after operations and whatnot. I mean, any comments or thoughts, I guess, on chronic physical health conditions and the impact and the nuances around mental health for that? Anyone?
Well, first of all, I wanted to say thank you for raising that comment and for kind of sharing your experiences. And I think it is a real challenge. I think there is a definite relationship between chronic physical conditions and mental health difficulties. And I think we're really only beginning to scratch the surface to best understand how to balance that. Balance supporting those different conditions. And I think you're absolutely right. For some individuals, accessing online support or digital support, wouldn't be helpful to them. So being able to then kind of access other types of support and in real life support is, really important.
Monika, Floro, any thoughts? Because they've gone on to ask, which I've just caught, like, do they think it'd be suitable for them to even try digital help?
Well, yeah, if the patient experiencing chronic illness is living somewhere else, I mean, far-flung areas, then the online tools could be very useful for the patient. And people experiencing chronic illness usually is also experiencing anxiety, depression. So the focus of the treatment should not only be on the improvement of the physical body, but also on the mental side. So it should be multi-professional level in dealing with the patient with chronic illness.
Yeah, and I guess Oh, sorry, was someone else going to say something then?
I was just going to say, yeah, I agree with Flora, and I guess with any of these things, if something isn't working and isn't being useful, then we should stop using it, and then kind of make sure we've got the other safeguarding procedures in place as well.
Yeah, that goes on the side of palliative care. So if patient is under palliative care, so they really need mental health support much more than of the medical treatment. Yeah.
Yeah. Also, and I guess it's important that as it's a collaborative thing you can do, maybe with the person who's helping you with your chronic health condition, talk to them about some of the online tools that you might have seen, and discuss together what might work best, and what might work well for what you're dealing with. Thank you so much for sharing that, Borislava. We've got one more question on the questions board. It's from Rachel Yudan, and it's a more practical question. She has said she works in a GP practice and tries to signpost young people to helpful digital resources in regards to health concerns. With anxiety and stress on the rise every day, are there any free apps or resources that they can use to help control use, but also to help their mental health? They often recommend reducing screen time in regards to social media to help with anxiety. On a more personal level, she has also had therapy in the past 2 years, I believe, but would be game to try online tools for maintenance of my mental health. So I guess, yeah, any kind of useful free apps or resources that young people can help control their use of screen time, but then also any other kind of tools to help with their mental health. Monika, do you have any thoughts on this one?
To be honest, I don't have the information to give a specific example of an application that can help in this case, but I do believe that with good research and, of course, checking the sources and of these applications, I think everyone can find something suitable to support themselves in this process of healing and having a good mental health.
Brilliant.
Yeah.
Thank you, Monika. Julian?
Yes, I was going to agree with Monika. It's important to kind of understand what's going to be a suitable tool for a given individual. I think Headspace is widely used, particularly in this country, and has a range of kind of different sort of mindfulness-based tools. And I've used it before and find it useful. Computerized cognitive behavior therapy for kind of anxiety and depression is kind of one recommended approach, and is kind of feeding into the NICE clinical guidelines, which is kind of one of the important governing bodies in this country. So yeah, I'd recommend checking out the NICE guidelines and also the NHS apps library store. And there are other organisations that quality assure different apps. So another good one to look at is Orca, OCRHA, I think is how it's spelled. But maybe we can collate some resources and share it with the group after today's session.
Yeah, brilliant. Yeah, Floro, anything to add to that question?
I don't know any apps that could help the younger generation, but in relation to that, we have the software in the workplace. When you are in front of the monitors or computers, it pops up. It depends on how you manage the time. I mean, if you're sitting down in front of the computer for 15 minutes or 30 minutes, it pops up and it reminds you that you should do stretchings. You have to move. You have to stand up. Maybe those kind of apps that would help at least encourage us doing few movements in the workplace when you have spent so much time already in front of the computers. Or maybe I could also recommend to digital app developers to develop an app that would help shut down your phone if you have been using it for 30 minutes or an hour. So it's one way of helping the youth to encourage to stop using mobile phones at certain amount of time.
Brilliant. Thank you, everyone. And we're slowly coming to that was the last question, and we're slowly coming to the end of the webinar. And it's when you mentioned that screen time thing, Flora, I've heard of that actually, and I think it'd be really good to have in our workplace about telling us to get up and go for a walk or whatever, because we can get sucked in quite easily. So I've just done the questions. So would any, like, just one or two lines to sum up your thoughts and feelings about digital support and mental health and what we need to be aware of, but what is the positives coming out of it? Julian?
I suppose how we can, I think this has been a really useful conversation to have, and I think the next step for us would be to reach this out and kind of involve more young people in this dialogue. So yeah, I think that would probably be my concluding thought.
Brilliant. Thank you, Julian. Monika?
Yes, I agree with Julian. We definitely have to tackle more people and include them in this kind of conversations, because even for me, I have some things to think about now and things to research more about. So I think it's very useful to involve as many people possible and have a bigger influence.
Brilliant. And lastly, Floro, any final thoughts?
Yeah. I mean, I'm not against social media. I even encourage people to use social media to do networking, to encourage to talk if they don't have any friends. So it's highly welcome. So, but the thing is, the different sectors of society should discuss on how to protect the youth or the children from the threats of cybersecurity. I mean, it's not just a responsibility of one sector, but it's a multi-sectoral responsibility. So yeah, I'm encouraging people to use social media, but of limited amount or limited time.
Yeah. Brilliant. Well, thank you very much, everyone. Thank you, Julian. Thank you, Floro. Thank you, Monika. That brings us to the end of our webinar today. Just to give a brief apology for those who maybe joined us late, there was a confusion with the time on the original time slot of the webinar with daylight saving in the UK, ironically. This will be put up on YouTube, and I think we're going to release it as a podcast as well. So you don't just have to look at my face for the entirety of an hour and a half. But please follow Eurayouth Mental Health on Instagram, Facebook, YouTube, Twitter, to hear more about our work going forward. We hope to do more podcasts or conversations like this. I think, as everyone's just agreed, it was a really useful, rich conversation, bringing in different cultures and ideas from different countries. And you can go on our website, www.eymh.org, or email us for more information if you'd like to hear more about what we talked about today. That's info@eymh.org, not info. That's a typo with the R. And then today specifically, as you're aware, is Youth Mental Health Day for the European Public Health Week. And so there's lots of activities going on. If you go to their website, EUPHA, you can find a list of all the activities going on. There's another webinar this afternoon. There's one going on now, which I think still has half an hour left, on LGBT issues around mental health, and this afternoon is around active behavior, I believe, as well as our own all-day campaign. We're just asking everyone to do a short post on Twitter or Facebook or Instagram, sharing with us how you look after your mental health with the hashtag #MyMental, and follow that up with the hashtag EUPHW for the European Public Health Week. So thank you again, everyone, and take care, and we'll hopefully see you soon. Bye.